Welcome. We're going to discuss our recent randomized controlled trial of a new vascular therapy for Alzheimer's disease. Let's get started. There are many arguments about the causes of Alzheimer's disease, but a few hypotheses have really risen to the top. The most commonly discussed is the so-called amyloid hypothesis. Here, amyloid protein, also called amyloid beta or A-beta, forms plaques or globs in the brain tissue, and that, along with neurofibrillary tangles, are the pathologic definition of Alzheimer's disease. And these amyloid plaques and tangles lead to a cascade of functional and anatomic abnormalities that are really characteristic of Alzheimer's. However, although the amyloid plaques are characteristic, many people with amyloid buildup never develop Alzheimer's disease. And new trials have shown that even when drugs clear almost all of the amyloid from the brain, that doesn't halt or even reverse the progression of the disease. Another hypothesis that is the vascular hypothesis, and data for this has been building over many years, based on some early observations that more than 80% of Alzheimer's disease patients have buildup of cholesterol plaque in the brain arteries. And more than 90% of Alzheimer's patients have buildup of this amyloid beta protein in the arteries themselves. It actually infiltrates the wall of the artery, narrowing the passage that blood flows through in order to supply the brain. It's been seen that essentially all Alzheimer's patients have reduced brain blood flow, and that begins years before there's significant amyloid beta buildup. And all Alzheimer's patients have small blood vessel disease in the brain. So you can put these two leading hypotheses together in what's called the two-hit hypothesis. Blood flow is one hit, amyloid buildup is the other. So let's start with the red box on the slide, amyloid buildup. Amyloid is overproduced in Alzheimer's disease. And not only is it overproduced, but the normal pathways by which it's removed from the brain don't function as well. So you have more production, less clearance, you end up with accumulation of amyloid. And amyloid is directly toxic to brain cells. It reduces connection between them and results in inflammation and reduced cognition, reduced overall brain function. But that's not the only problem with amyloid buildup. Amyloid causes direct effects on the blood vessels. It causes vasoconstriction. The blood vessels literally spasm, the small capillaries, reducing blood flow to areas of the brain. In addition, amyloid reduces vascular reactivity. Now, that's something I'm going to talk about a lot. Vascular reactivity is the ability of the blood vessels to open up and let more blood come through when more blood is needed. Amyloid causes neuroinflammation, and it causes the cerebral amyloid angiopathy, what I mentioned before, where the amyloid actually goes into the walls of the blood vessels, swelling them up and closing them off. So amyloid production or buildup causes all these things which work to reduce brain blood flow. Reduced brain blood flow causes reduced brain function. The brain will not work without blood and oxygen. But that's not the only effect of reduced brain blood flow. Reduced blood flow affects the enzymes that produce the amyloid beta protein, causing them to make more of the toxic type that accumulates in plaques in the brain. You need blood flow also to remove the amyloid that's built up. So when you have less blood flow, you have less removal. So low blood flow causes amyloid buildup. Amyloid buildup causes low blood flow. You have a vicious cycle going between the two. You could almost say it doesn't matter which starts first, amyloid buildup or reduced blood flow. Once things have gotten going, you have a vicious cycle where they're both causing each other. And both of these things, blood flow and amyloid buildup, reduce brain function. So counterpulsation and this device Cerezen, which we studied, is a direct attempt to reduce all of these vascular phenomena that we've talked about and break this vicious cycle by snipping it at the vascular side. In the center here, we see a Cerezen device. As you can see, There are cloth cuffs that fit around the legs and the waist. These are very much like large blood pressure cuffs. They are capable of being inflated and deflated very rapidly. As shown in the picture, the animation on the left, as they inflate, they sequentially squirt the blood out of the legs into the core body, and then they deflate simultaneously, letting the blood back into the legs. This happens over and over in counterpulsation to the heart. What that means is it happens between heartbeats. So the heart contracts, squirting blood to the body, then it relaxes, then the Cerezen device pumps blood back to the core body, then it relaxes, then the heart contracts, and you go back and forth, and generating this rapid to and fro motion of the blood. Now, the lining of the arteries has special sensors to detect this. And when it detects this back and forth motion, it triggers a cascade of changes that are basically very similar to what happens with intense physical exercise. So among these changes, exercise-like changes, are increased production of nitric oxide. Now, nitric oxide is a well-known regulator of oxygen metabolism and of blood flow throughout the body. Counterpulsation also reduces vascular inflammation, and it increases arterial flexibility or compliance, which is lost as the arteries stiffen with age. It increases vascular reactivity, which I talked about earlier, the ability of blood vessels anywhere in the body to open up and produce more blood flow when more blood flow is needed. And counterpulsation improves vascular collateralization. Well, what is that? Collateral arteries are backup arteries, very tiny, that exist by the millions throughout the body. They're normally blocked off with little or no blood flow. In the bottom of the slide, we see some X-ray pictures from a study done of heart attacks in dogs, done some years ago. X-ray dye is injected directly into the arteries of these hearts so you can see where the blood flow is going. And on the left, you see dog heart without counterpulsation. On the right, you see one where the dog had received several hours of counterpulsation treatment after the heart attack. You can see from the image on the right that thousands of tiny blood vessels have opened up. Those are the collateral arteries, and are providing additional blood flow and oxygen to that tissue. This opening up of collateral arteries is well documented as a common occurrence with counterpulsation type therapies. Let's talk about the study of Cerezen. We looked at 190 patients with either mild cognitive impairment due to Alzheimer's disease or mild Alzheimer's disease. Together, these are lumped together as early Alzheimer's disease. Now, many recent drug therapy trials for Alzheimer's have been faulted because most patients who volunteered for the study were rejected because they had pre-existing conditions of various sorts. In this study, 70% of patients were accepted, as opposed to as little as 10% in some of the drug trials. Since this treatment involves squeezing the legs to squeeze blood to the body, a true placebo is not possible. People know when you're not squeezing their legs. So subjects were randomized to one of two arms. One was a very low pressure arm where we felt there would be minimal effect of the treatments, and we called that the sham arm of the study. Another arm was a full pressure standard Cerezen treatment, which we called by the name of the device, Cerezen. Treatments were 1 hour each, and each subject received 3 to 5 treatments a week for 35 treatments, then twice a week out to 6 months. After 6 months in the study, we stopped all treatments, but we kept following the patient. And we looked at them multiple times, including 9 months and 1 year, so up to 6 months after treatments were stopped. We looked at a number of tests. I'm listing some of them here. They included the Alzheimer's Disease Assessment Scale, the Vascular Dementia Assessment Scale, assessment of activities of daily living, and a number of other tests to look at various aspects of memory, reasoning, independence of function, etc. The study was conducted in 10 sites across the United States, as listed here, and although most recent Alzheimer's therapy trials have been criticized for having very skewed demographics. Our demographics were very close to the population of the United States where the trial was performed. We had 14% African American, 19% Hispanic, 4% Asian, and 61% women in the population, pretty close to the population as a whole. Now, long story short, the results met all primary endpoints and virtually all secondary endpoints. Let's look at just some of the data. Here we're looking at the Alzheimer's disease assessment scale, and we're looking at 1 year worth of data. The 0 line on the vertical axis indicates where every patient started, and what we're showing here at each point is the change for patients relative to their own personal baseline. And the orange lines at the bottom of the graph are from a recently published trial of an anti-Alzheimer's drug. The dashed line indicates the natural progression of disease in this population. That's the placebo arm from that trial. And you see that patients lose, on the average, about 3 points on this test over the course of a year. The dotted line shows the effect of the anti-amyloid therapy. It's a drug that removes amyloid from the brain. And you can see that they decline about 30% less. This is a real accomplishment, but notice that they still decline. And nobody's stabilized, and certainly nobody's improved over their baseline function. Now, the blue line indicates the results of Cerezen in this trial. And you see that very rapidly people started improving over their baseline, not just not declining, but actually improving. And for the entire 6 months that they received treatment, they got better and better. Now, when we stopped the treatment at 6 months, as you can see, there was a slight drop-off in function, but the great majority of the improvement that they'd obtained at 6 months was still there at 1 year. This effect was very statistically significant and seems to be a very robust effect. Here we're looking at activities of daily living or functional independence. The scale on the vertical axis indicates change from a person's baseline, and this is again 1 year's worth of data. This scale looks at how much help a person needs to do daily activities. Do you need help having your food cut up for you? Then you lose a point. Do you have to be spoon-fed? You lose some more points. Do you need help dressing? Do you need help bathing? Each of those things is reflected in this assessment. It's how well can you live without assistance, independently. And you see the sham arm in the orange has, although there's some noise, a gradual decline, as expected, over the course of the year. But the group that had the Cerezen treatments with counterpulsation, in fact, improved over their own personal baselines. And the improvement lasted, with some noise, lasted out to 1 year, even though they hadn't had treatment for the last 6 months. And if you compare the treatment group, the Cerezen group, to the sham group, you can see there's quite a difference. And this was statistically a very significant difference as well. We had significant differences in the other and significant responses in the other tests that we did as well. We noted that Cerezen treatment had particularly beneficial effects in those patients who had diabetes along with their Alzheimer's disease. This was not a surprise because both Alzheimer's and diabetes have many factors in common, and most of these factors, in fact, involve the aspects of blood vessel function that I list here on the slide. And the factors that I list here are all known from one part of the studies of one part of the body or the other to be favorably affected by counterpulsation. There were no serious device-related adverse effects during this study. 16.3% of patients had, at some point during the 6 months of treatment, some skin chafing or bruising, none of which required discontinuation of treatment. Generally, when this happened, it was easily eliminated by small adjustments to the cuff positioning or adjustments to the clothing that the person was wearing to treatments. The conclusions of the study are these. We found that Cerezen treatment was well tolerated with no serious adverse events. The majority of patients improved over their own baseline, not just declined less rapidly, but actually improved. And at 1 year, most patients were still improved. And not only were they improved in cognition and improved in their independent function, but they were improved at both at the same time. We feel that Cerezen is an effective and low-risk treatment for early Alzheimer's disease. And in recognition of this, the European Union recently certified Cerezen under the medical device regulations. And the indication they certified for is Cerezen is indicated for the treatment of mild cognitive impairment due to Alzheimer's disease or mild Alzheimer's disease. Now, I should note that Cerezen is CE marked in the European Union, but it's not cleared by the U.S. Food and Drug Administration, and it's not available for sale in the United States. Thank you for your interest in this study. We are thrilled by the results that we've seen with Cerezen treatments, and we are delighted by our recent clearance by the European Union. We are especially thrilled and excited by the chance to bring this new treatment to patients with Alzheimer's disease. Thank you.